Hi, my name's Olivia. I'm going to be taking care of you today. What's your name?
Ines.
And wash my hands. And Ines, what's your date of birth?
May 23rd, 84.
Okay. Just to let you know, I'm going to be writing down everything, so I hope that doesn't bother you. Thanks for bearing with me.
Thank you.
So, what brings you in today?
I've been having fever and headache for about 3 days.
Fever and headache? Okay. When did you notice these starting? 3 days ago?
3 days ago, yeah, during the weekend.
And did they both start at the same time?
Yes.
Okay. And what were they doing? What were you doing when they started?
It was in the afternoon. Actually, I took a nap on Saturday, and I woke up because of the headache.
And then, did you take your fever and you noticed?
Yeah, because I felt I was having like pain all over my body, so I decided to take my fever, and sure enough, I had fever.
Okay. What method did you use for taking your fever?
I have a thermometer that I used under my tongue.
Okay. And what was your temperature, do you remember?
Yes, it was 38.5 in Celsius.
Okay. Do you know what that goes to in Fahrenheit?
I'd say maybe it's 100 in
Okay.
Fahrenheit, yeah.
100 in Fahrenheit. Okay. Does anything make the headache worse?
I've been taking Tylenol, and it helps the headache, but as soon as the medicine effect goes, I start having the headache again.
Okay. And you start having it again. And has this ever happened before?
No, it's the first time.
And does anything make it worse?
No.
Okay. And does your head pain go anywhere? Like,
No.
does it radiate?
No.
And on a scale of 1 to 10, how would you rate your head pain?
It's really bad. I'd say 7.
A 7?
Yeah, and I also just want to mention, you asked if it goes somewhere else. Well, I can't say it's like related, but I have been having some joint pain and muscle pain too.
Oh, okay. Some muscle pain. Interesting. If you don't mind, with your finger, I know this is kind of a weird question. Can you like point to maybe the area of your head that hurts most with the headache?
Actually,
or is
it's
it
all
just all
over.
over?
Yes.
And would you say this is constant or intermittent?
It is constant. It
Constant.
only stops when I take Tylenol.
It only stops when you take meds and Tylenol. Okay. And sorry. So about your fever, do you still have it? Does anything make it better or worse?
Yeah, I think the Tylenol, when it helps with the headache, it also brings my fever down, but then it comes out after the 4 hours.
And have you been did you only take your temperature once, or have you been taking it?
No, I've been taking it, actually, like, I know I'm having fever because of the chills and everything else that would be going on. So I only take it when I'm suspecting if I have fever or not.
Okay.
Other than that, I know I'm having fever.
Okay. And would you say you feel like it's constant except for when you take the medicine? Okay. Now, I'm just going to ask you a couple of questions. So, have you noticed any weight change recently?
No.
No weight change?
No.
Have you had a fever, weakness? Well, you have had fever.
Yes.
Any fatigue?
Yes, I feel fatigued.
Fatigued? And do you have weakness?
No, not really. It's just the fatigue.
Just the fatigue? Okay. And then, have you had any like head injury recently?
No.
No head injury. Do you have dizziness or lightheaded?
No.
No dizziness or lightheaded, but you do have the headache.
Yes.
Okay. So, you also said you were having some muscular pain, correct? Some joint pain. So, do you have stiffness?
No.
No stiffness?
No.
Do you have a history of arthritis or gout?
No.
What about backache?
No.
And And what's the location of your affected joint? Like, where would you say it is?
Overall, like, it's not in one place. My knees, my elbows, my
Knees and
wrists,
elbows.
yeah.
Okay. Has anything made that better or worse?
Except for the Tylenol, nothing makes it better or worse.
Okay. Any swelling or redness?
In my joints or somewhere else?
In your joints?
No.
Or, but there is pain.
Yes.
Now, is it tender, or like when you touch it, does it hurt?
No, it's just there all the time. It's like dull pain that is there all
Dull
the
pain?
time. Yes.
Okay. Would you describe stiffness?
Yes.
What about weakness?
No.
No weakness. Limited motion action? Like,
No.
can you move okay?
Yes.
Everything? And you said timing of symptoms, it's all the time.
Yes.
And has this been going on for 3 days as well? Or
Yes.
Yeah.
Yeah.
And do you have any history of trauma or anything like that?
No.
Is it in your neck or lower back pain?
The pain, you
Yes.
mean? Yeah, I feel it sometimes in my neck also.
Okay. So I'm also going to ask some question on your I'm also going to ask about your eyes.
Mhm.
So how's your vision?
My vision is good.
Vision's good. Do
Yeah.
you have any glasses or contacts?
No.
And when was your last exam?
2 years ago.
Okay. And do you have any pain, redness, or excessive
No.
tearing?
No.
Double vision?
No.
Or no? Spots or flecks or flashes or lights?
No.
And do you have any history of glaucoma or cataracts?
I was just told to watch for glaucoma. I don't have it, but I have the structural abnormalities that could lead to glaucoma. So I was just told to watch out.
Okay. Interesting. We'll take a look at that and just see how everything's
Thank
going
you.
for you as well while we're here. Okay. So I'm going to ask you a little bit about your past medical history. So did you have any childhood illnesses such as measles, mumps, rubella, whooping cough,
I had chicken pox
Chicken
when I
pox?
was 2 weeks old.
When you were 2 weeks old?
Yes.
And then did you have any rheumatic fever, scarlet fever,
No.
polio, diphtheria?
No.
And no psychiatric conditions?
No.
Okay. How about your childhood immunizations? Did you get polio, MMR?
They're all up to date.
All of them,
Yeah.
tetanus, diphtheria,
Everything. Yeah.
Let's see. Do you have any adult illnesses, such as thyroid disease, heart disease, hypertension?
No, I can't think of any.
What about diabetes, COPD?
Actually, I have asthma.
Asthma?
Yes.
Okay. How long have you had that?
It's been 10 years.
10 years?
Mm-hmm.
And do you take any medicine for that?
Nothing is regular. I just take as needed an inhaler. I think it's, I can't remember the name, but I take the inhaler. I would take 2 puffs every 4 hours, and usually, like, I would need it for 2 days only.
Okay. Do you have any history of cancer, HIV, hepatitis, kidney disease, blood clots, or psychiatric?
No.
No? And then, are you up to date on your immunizations, such as the influenza, zoster, pneumococcal, and Hep B?
Yes.
Yes?
Yes.
Okay. So, do you have any allergies to any medications, animals?
I am allergic to sulfa medications and oxycodone.
And oxy. When did you notice the allergy with the sulfa?
I don't know about it. Apparently, I had a reaction when I was a baby, so my mom told me that I have it.
Does she know what reaction? Did she tell you what
I
reaction
think I
you
had hives.
hives?
Yes.
And then, what about the oxycodone?
The oxycodone, I know it happened. I was itchy. That was about 2 or 3 years ago.
Okay. Okay, and so other than the asthma, do you have any other medical illnesses?
No.
Okay, and have you had any accidents or injuries?
I broke my left arm same time as the oxycodone incident, like the rash, because actually I was
Okay.
given that because of my arm pain.
Okay, so 2 years ago.
Yeah,
Got
so,
it.
yeah.
Do you have any, like, the castor on?
Yeah, they put a splint on it for about 4 weeks. I did occupational therapy during that time, and everything healed well.
Everything healed well? That's
Yeah.
awesome.
Thank you.
And did you have any hospitalizations or surgeries? No? Okay. Just gonna go over your symptoms one more time to make sure I have your whole picture really fast before we go on to the next section. So you have a fever and a headache that you've had for 3 days, and it also turns into kind of like muscular joint pain as well. And you took your fever, and the only thing that helps make it better is when you have Tylenol. It goes down. Okay. So I'm going to ask you about your health maintenance. All your immunizations are up to date. Have you ever checked like for your cholesterol?
No, never been checked.
Never checked?
I don't know if my doctor had asked for it before, but like I don't think we ever talked about it.
You know, we'll go over that as well.
Thank you.
We'll help you out with that. When was your last mammogram?
Actually, I don't do it yet. I wanted my doctor to do it, and he said it's too early for me.
Okay.
Yes, he said we start around age 40, and I'm not there yet, so he's holding on to that.
If you don't mind me asking,
Yeah.
what's your age?
I'm 34 now.
34. Could have got that for my birthday. And do you have any tuberculosis screenings that
Yes, I just did one, say 3 months ago, and it was negative.
Awesome. And have you ever had a lung cancer screening?
No.
And have you ever had a colonoscopy?
No.
You haven't need one. Any fecal tests? Any
No.
checking?
I didn't need one.
And then when was your last pap smear, or how have you had your last pap smear?
Yes, it's been a while. Let's say it's been 2 or 3 years.
Okay.
And it was negative.
Okay. So I'm going to ask you some questions about your menstruation. Do you know when you got your first period?
I was 13 years old.
14 years old. And what was your what's your average length of your cycles?
Average 3 to 5.
3 to 5 days. And do you know when your last menstrual period was?
3 days ago.
3 days ago?
That's when it ended.
Okay. And do you have is it consistent, like your period
Always
coming
on time.
about like how every 28 days?
Yes.
And do you experience any pain with that?
Sometimes, not always.
Just like, how would you describe it?
Like I would have once a year, I would have it really painful. Like out of 10, I would say 9. And then that would be it. The rest of the time, it's just okay.
I'm sorry to hear. So I'm gonna ask you some questions now, just about on your like social history and stuff like that. Are you sexually active? Yes. And how would you describe your partner's genders?
He's now.
Male. And do you use any protective barriers?
Yes, we use condom.
And are you intimate with any other partners?
No.
And have you had any new partners in the last 6 months? Do you have any histories of STIs?
No.
And how would you describe your relation? Are you married?
Yes, I am.
Yes, married. Congratulations.
Thank you.
Okay. How would you describe your relationship in 3 words?
So, I'm happy. Still trying to figure it out, if that counts as one.
Yeah.
I mean, we're just like recently lived together, so we're trying to get used to each other.
Exciting
Yes,
time.
yes. And what is the 3rd word? Could be. I don't know. I can do it in 2 words.
Yeah, I feel like those are good 2 words.
Good.
And do you feel safe
Yes, absolutely.
and do you feel respected?
Yes.
And do you have any concerns or questions for me right now?
No, I just want to get to the bottom of this and see what's happening with me. I'm so tired.
You're very tired?
Yeah.
Has that been going on with the past 3 days? as
Yeah,
well?
yeah.
No. Sorry.
And I don't know if you noticed these rashes on me. They're
Oh.
all new. Yes.
Oh my goodness.
Yeah.
I did not notice your rashes.
Yeah, I'm sorry, I didn't mention it, but.
Oh, no, that's not your
yeah.
fault. Should I ask that question?
Yeah, thank you.
So, tell me about your rashes. Has that been going on for 3 days? When
Yes,
did they
this
appear?
all started and it's all over me.
All over.
Yes.
Has anything made that like worse or better?
I've been trying to use creams. I thought maybe it's dry, but it doesn't look like it's helping.
Okay. Are they itchy?
Yeah, sometimes, yes.
Itchy. And do you experience dryness with your skin?
No.
No. Has there been any change in color?
It's just red.
They're just red?
Yeah.
Are they elevated or anything like
No,
that?
no.
Not elevated. How would you describe like the rash? Are they like all over? Is it like pinpoints or is
It's all over and it seems like it's at the same level as my skin. It's just like you can tell there is something unusual. See, like it's red.
it's all no lumps or sores or anything, just like the rash?
I feel like there are lumps
Oh.
here. Yeah.
Oh my
yeah.
goodness, so swollen
Yeah,
lymph nodes.
yeah.
And that's been going on for
Same time.
Same time?
Yes.
So you would you describe those as painful?
No, they're just swollen.
Just swollen? So not painful at all, just swollen. Are they tender to touch at all?
No.
Okay, well, thank you for letting me know
Yes. No problem. I should have mentioned earlier, but I'm just having this headache. I
Oh,
can't
no,
think.
that's totally fine.
Sorry.
Have you ever had like the rash before?
No.
And would you say it has gotten better? I mean, not better. Has it like gotten worse?
It's kind of progressing, yes. Like it started a little and then now it's more, but it's kind of stable now.
But it happened at the like same time.
Around the
as
same time,
as
yeah.
everything.
Yeah.
Okay. Now a question for like your skin and your rash or anything. Did you get any new laundry detergent or anything, or any new outside agents? No. Okay. Go back to your social history because I'm confused. Think about what you're saying. Where is your birthplace?
That's overseas. Yeah.
And how was your childhood? How would you describe your childhood?
Happy. I'd love to go back to my childhood.
Well, me too. And what is your occupation or job?
I'm a student right
Student?
now.
Oh, awesome.
Yeah.
Where do you go to school?
I'm just taking prerequisites. Yeah, in Bucks County.
Are you enjoying that?
I love it.
Any stress or anxiety with it?
No, nothing out of the usual. It's just like, sometimes when you have exam, but it's the normal thing, I think.
I'm sorry. So do you live in a dorm right now?
No, I live in my own house with
You
my
live in
husband.
your own
Yes,
house?
yes.
Oh,
It's actually an
I
apartment, I
totally
should say.
forgot you live with your
It's
husband.
okay.
And is it just you two in the house?
Yes.
Do you have any pets?
No.
And you said no unusual stress or anything
No.
like that. Do you have a military history?
No.
And what's your financials at home?
Everything's fine.
Everything's good.
Yeah.
What do you enjoy doing for fun?
Sometimes we go hiking. We go to the beach. We hang out a lot with our friends, out for drinks, stuff like that.
Oh, that's
Yeah, we live
fun.
in the city, so everything is accessible.
That's awesome.
Yeah.
Yeah. And how's your sleeping?
Very good.
Very good.
Yeah.
That's good, especially with all your symptoms.
Yes. No, I still sleep good. Yeah, regardless of what's
That's good.
happening. Yeah.
I totally get that. And do you exercise at all?
Not consistently. I try, but I have to admit that it's not consistent.
So, tell me about your alcohol use.
Occasional only, like once a week, sometimes even once every 2 weeks.
Okay. And what type of alcohol and about what size?
I would have either 1 glass of wine, like the regular size, or 1 beer.
Okay. And do you use any drugs or anything that prescribed or not prescribed?
No.
Do you have tobacco use, like
No.
smoking or anything? Okay. We're gonna go into your family history right now. So, do you have anyone in your family have history of headaches, seizures, disorders, like your parents, grandparents, or your children?
No.
Do you have
No,
children?
I don't have.
You don't have any
Yeah.
children. So no histories of headache, seizure, stroke, mental illness, substance abuse, thyroid disorder, coronary artery disease, hypertension, lipidemia, no, diabetes, asthma,
My dad is diabetic.
and about how old is he?
Right now he's 80.
Okay. What about renal disease, arthritis, allergies,
No.
cancer, any genetically?
My maternal grandmother passed away from cancer, and I should actually go back and say stroke. My maternal grandfather, he passed away because of that.
If you don't mind me asking, what kind of cancer did your grandmother have?
I think it was colon cancer, and my paternal grandmother's diabetic too. Was diabetic.
Your
My dad's mom.
Organization has never been my strong suit, but I will do my best to get it together. What's next?
Maybe the breast episode.
We're all that's right. That's
yeah.
okay. Okay, I'm just gonna ask you some more questions. So, in your ears, do you have any? How's your hearing?
Good.
Hearing's good.
Yeah.
Do you have any sounds in your ears you hear? Like,
No.
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 Do you experience any vertigo, earaches,
No.
infection,
No.
discharge of your ears, or do you use hearing aids?
No.
No. Okay. Do you experience frequent colds,
No.
stuffiness? Do you have any discharge or itching in your nose? No. Hay fever, nosebleeds, or sinus troubles? No. Okay. Just gonna ask you a few questions about your throat.
Mm-hmm.
Do you have any conditions with like your teeth or your gums?
No.
No. Do you experience any bleeding with them or anything?
Sometimes when I floss. Yeah.
And do you wear dentures?
No.
And when was your last dental exam?
Not long ago, maybe 2-3 months ago.
What time does it say there?
25.
That